What is laser iridotomy for angle closure glaucoma? Have you ever wondered how doctors treat angle closure glaucoma? One common method is called laser iridotomy. This procedure helps manage a serious eye condition where the drainage angle of the eye gets blocked. When this happens, pressure builds up inside the eye, which can lead to damage of the optic nerve and loss of vision if not treated promptly. So, what exactly happens during laser iridotomy? The procedure uses a laser to create a tiny hole in the peripheral part of the iris, which is the colored part of your. This small opening allows the fluid, known as aqueous humor, to flow freely into the front part of the eye and drain properly. By doing this, the procedure helps relieving the pressure that can cause harm to your vision. In angle closure glaucoma, the iris can be pushed forward, which narrows or even closes the drainage angle. This blockage can occur due to a condition called pupillary block, where fluid gets trapped behind the iris because it cannot pass through the pupil. The laser iridotomy creates a new pathway for the fluid to escape, helping to equalize the pressure on both sides of the iris. This often causes the iris to shift slightly backward, deepening the front chamber of the eye and improving fluid outflow. Doctors typically use a YAG laser for this procedure. They aim for a naturally thinner area of the iris, known as an iris crypt, to create a small opening about 150 to 200 micrometers wide. The hole is usually placed in the upper part of the iris, which is hidden under the eyelid to minimize any visual disturbances. Laser iridotomy is often the first treatment recommended for patients with chronic angle closure glaucoma. It can also be used preventively for individuals with narrow angles who are at risk of acute angle closure. The procedure itself is quick, usually taking just 5 to 10 minutes, and is often done with topical anesthesia and pupil-constricting drops beforehand. After the procedure, doctors monitor the intraocular pressure and may prescribe anti-inflammatory eye drops to help reduce any inflammation. Candidates for this procedure include those with narrow or closed angles, elevated eye pressure, or early signs of glaucoma damage. It is especially recommended for individuals with risk factors such as Asian ancestry, shorter eyes, female gender, farsightedness, or a family history of glaucoma. While laser iridotomy is generally safe and effective, it does come with some risks. These can include temporary eye pain, bleeding, glare, or, in rare cases, worsening of the condition. Therefore, it is crucial that this procedure is performed by an experienced ophthalmologist, with appropriate follow-up care to ensure the opening remains effective. In summary, laser iridotomy is a vital procedure that creates a small hole in the iris to restore normal fluid flow in eyes affected by angle closure glaucoma. This helps lower intraocular pressure and protects the optic nerve from damage. If you think you might be at risk for angle closure glaucoma, it is essential to consult with a healthcare professional for personalized advice and treatment options.